For the wider population, as at August the 2nd, 77% have gotten at least one dose. Meanwhile, indicated by the orange line, 63% of the population, or 3.5 million people, are fully vaccinated. And this is 1 percentage point higher than the day before.
We're happy to welcome back Professor Teo Yik Ying to assess our current COVID-19 situation. Prof. Teo is the Dean of NUS's Saw Swee Hock School of Public Health. Welcome back to the show, Professor. It looks like we're on track to meet our National Day vaccination goal of fully vaccinating 2/3 of the population. On the flip side, there are currently 100 active clusters as at yesterday, and the number of unlinked cases has increased in the past week. With these in mind, Professor, ahead of the task force's midpoint review, where do we stand?
Thank you very much for having me back. So actually, the number of active clusters in itself, like the number of infections reported daily, is not as worrying or as important as 6 months back. And that is because we now have about 62% of the population be fully vaccinated, and we are on track to fully vaccinate up to 80% of the population by the end of August. And what this means is that despite the relatively high number of daily reported cases, as well as the number of active clusters or even the number of unlinked cases, what we see is that this did not translate to a spike in the number of cases developing severe disease, to the point they need oxygen supplementation or ICU care. So certainly there is an increase in the number of people in the hospitals that require oxygen supplementation. And very important for us to see is that most of these people are the ones who are unvaccinated or only partially vaccinated. So what we are looking at very closely is whether some of these active clusters are happening in locations where the elderly or people with medical conditions are commonly found at. And if that happens, then we need to intervene very decisively to break the transmission chain quickly, to avoid other vulnerable individuals from being infected, especially if they remain unvaccinated. And this is exactly what we're doing with the hospitals. And we saw in the news today that all visits are temporarily ceased for the next 2 weeks, because we see that there are clusters in 2 of the large hospitals we have in Singapore. Also, I think it's highlighting that the high number of clusters or unlinked cases is actually an indirect consequence of high vaccination rates. And that is because a vaccinated person, it's more likely to be infected but may not have any symptoms. So let me say this again. A vaccinated person, when infected, is much less likely to develop any severe symptoms, or more likely will not have any symptoms at all. So this person may not even realize that he or she has been infected and continues to go about their daily activities in public. So while a vaccinated person is less contagious when infected, there is still a chance of infecting others. And this is when new transmission chains or clusters may be seeded in the community. And that is why when we see more people get vaccinated, I actually expect to see cases popping up that may be unlinked or more small clusters emerging.
Right. So, Prof, it is early August, the midpoint. Given what you've just said, are we ready for some easing, at least for those of us who are fully vaccinated?
So I actually think that Singapore is ready to ease measures, of course, in a very calibrated manner in phases. So definitely not a single once-off lifting of all restrictions like in Freedom Day, and perhaps with some differentiation in the extent of easing for those who are fully vaccinated versus those who are still unvaccinated or only partially vaccinated. So some examples could be in terms of dining in. Vaccinated people may be permitted to dine in larger groups, whereas for unvaccinated people, dining in could perhaps be permitted, but for very small group sizes, maybe even 1 or 2 people. Social and fitness activities can also be permitted in larger groups for vaccinated people, but for the unvaccinated, they may still have some restrictions. And I really want to emphasize that the reason why we need to have some differentiation is because data from Singapore as well as overseas consistently show that vaccinated people have a lower risk of being infected. And when they are indeed infected, they have a much lower risk of severe disease and complications. So those who have been vaccinated are therefore much less likely to suffer from serious illness because of COVID-19. Now, for the unvaccinated, especially the elderly and those with underlying medical conditions, they are at risk of severe disease when they're infected. And this is exactly the reason why when we start to ease our measures, we need to moderate the activities of the unvaccinated people to protect them. It is not to discriminate, it's actually to protect them. Otherwise, it would actually be irresponsible to allow them to take part in activities where we already know come with higher risk of infection and transmission.